Let's talk about the most private and perhaps most honest warning sign your body can give you about your heart health: erectile dysfunction, ED. Many men experience ED and worry it's just aging or stress, but I see it differently. I see it as a critical early alarm. Here is the clinical reality. For many men, ED is not just a bedroom problem. It is a vascular problem, and it can precede a major event like a heart attack or stroke by 3 to 5 years. If you have high blood pressure, you are nearly twice as likely to also have ED. Good day, and welcome to Heart and Health. I'm Dr. Ed, a cardiologist. ED and hypertension are interconnected because they share the same root pathology: endothelial dysfunction. The endothelium is the delicate inner lining of your arteries, and it's responsible for producing nitric oxide, NO, which relaxes vessels. In the penis, getting an erection requires a massive surge of blood, dependent entirely on the health of these vessels and the NO they produce. High blood pressure damages the vessels throughout the body, including the penis, reducing blood flow and the ability to maintain an erection. This damage is a system-wide problem, but it shows up in the penis first. Why? Because the penile arteries are much smaller than the coronary arteries, so the damage shows up there earlier, making ED an accurate early marker of systemic vascular disease. In this video, I'm going to be giving you the 4 immediate steps you must take when this vascular alarm goes off. Disclaimer: please remember that the information shared in this video is for educational and awareness purposes only. These suggestions are not a substitute for professional medical advice. Viewers should always consult with their physician or a registered dietitian before making serious changes to their diet or treatment plan. Hit the like button and subscribe to this channel as we begin. Step 1. Get the full vascular screening. When ED appears, your first step must be to treat it as an alarm for systemic vascular disease, not just a localized issue. You need to look beyond your blood pressure reading, as high blood pressure often has no other symptoms. Your routine here is to demand a full vascular screening. This means a comprehensive lipid panel. Don't just check total cholesterol. Check for specific inflammatory markers and LDL particle count. High cholesterol is a key risk factor for ED and CVD. A glucose/insulin check. ED is very common in men with diabetes or insulin resistance. High blood sugar accelerates vessel damage. Testosterone levels. Low testosterone is frequently linked to ED and can increase the risk of having low blood pressure. ED offers an opportunity to implement effective therapeutic efforts to minimize the burden of major cardiovascular disease. Use this symptom as your motivation to get these underlying metabolic failures diagnosed. Step 2. Scrutinize your blood pressure medication. The second immediate step is to look closely at your treatment plan. Certain high blood pressure drugs can worsen ED, creating a self-defeating cycle and causing men to stop taking their essential medication. This is the drug dilemma. You should discuss these routines with your doctor. 1. You should ask your doctor about avoiding diuretics, water pills, and older beta blockers, like propranolol or metoprolol. Diuretics can reduce blood flow to the penis and deplete zinc, which is needed for testosterone. Beta blockers are often linked with sexual problems. 2. Consider switching to medications that are known to be neutral or beneficial to erectile function, such as ACE inhibitors, like lisinopril, or ARBs, angiotensin receptor blockers, like losartan. These drugs often improve blood flow, which helps ED. Never stop taking prescribed medication without consulting your doctor. Step 3. Implement integrated vascular exercise. The third essential step is turning your exercise routine into a targeted vascular repair system. Your goal is to improve blood flow, which is the mechanism for both lowering BP and improving ED. Routines to implement. Aerobic exercise is non-negotiable. Vigorous cardiovascular exercise for at least 45 minutes, 3 times per week, may help reverse some cases of mild ED. This includes brisk walking, jogging, cycling, or swimming. Moderate physical activity can reduce the risk of ED by up to 30%. Focus on nitric oxide. NO exercise stimulates the release of nitric oxide from the endothelium, helping to relax blood vessels. You should also support this by consuming NO-boosting foods like beetroot juice or arugula. Address psychological barriers. ED can cause anxiety, leading men to avoid sex. Exercise is a powerful tool to lower general anxiety and boost confidence. Step 4. Manage systemic stress and recovery. The fourth area recognizes that ED isn't purely physical. It's a symptom of a stressed, overloaded system. Anxiety and chronic stress cause the sympathetic nervous system to release adrenaline, which restricts blood flow, the opposite of what is needed for an erection. You can relieve stress and system overload by mastering the vagal brake. Use slow, controlled breathing or meditation daily to manually engage the parasympathetic, calming nervous system. This is essential for controlling the anxiety linked to both ED and hypertension. Getting high-quality sleep. Sleep is one of the key lifestyle changes that helps lower your risk of developing ED. Inconsistent sleep raises cortisol, which drives anxiety and tension. Quitting smoking can lead to improvement in mild ED symptoms after several months. Nicotine is a powerful vasoconstrictor that accelerates vessel damage. In summary, ED is not a separate problem. It is an early indicator of systemic vascular disease that often precedes heart problems by years. Both are linked by damaged blood vessels and endothelial dysfunction. The 4 immediate steps are: 1. Get the full vascular screening. 2. Scrutinize your blood pressure medication. 3. Implement integrated vascular exercise. And 4. Manage systemic stress and recovery. Use this alarm to your advantage. By treating the ED, you are treating your cardiovascular system, potentially saving yourself from a future heart attack. If you found this video empowering, please consider subscribing to Heart and Health. That button helps us reach more people who need this vital information. I'd love to hear from you. Which of these 4 steps are you prioritizing this week? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.